Enough for the rest of the class?
Oh, good afternoon. This is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Health Care Needs, and this is Conversations on Showing Up for Kids. We try to give a casual, informal type place to talk about what's important to families of children with special health care needs. I am really excited this morning to be joined by Nick Tanner. Nick is a legal advocate for ABC for Health, and so because we are getting into legalese, just want to remind everybody that this is being recorded, and please do not use any personal identifiable health information or any personal information that you do not want out there on the web. If you feel the need to give away your credit card information along with any other personal identifiable information, please send it to me personally, and I will make sure to refurbish my house. So I really do appreciate that. But if you don't want people having that information, then please do not share it. So today we're going to be talking about the basics of health check and this fun little thing called EPSDT, which of course to me sounds like a really bad medical condition. I do not want anybody coming up to me saying, hey, congratulations, you've tested positive for EPSDT. But in reality, EPSDT is a really good thing, and it's a really cool thing. So Nick, can you tell us a little bit about this EPSDT thing and how does it work?
Absolutely. So EPSDT is probably not the simplest acronym that they could have chosen for this program. However, it stands for early and periodic screening, diagnosis, and treatment, also known as health check in Wisconsin. The general gist of EPSDT is that it's supposed to provide a comprehensive array of preventative, diagnostic, and treatment services for low-income infants, children, and adolescents under the age of 21. So the 21 eligibility requirement is really important. Sometimes we think of children as being under the age of 18, but in terms of EPSDT, health check in Wisconsin, any child under the age of 21 that is eligible for Medicaid is eligible for the health check program. Just because I'm part of the legal world, if you're curious, it's part of the Social Security Act, which is where a lot of our health programs come from. And the nice part about EPSDT as a difference from normal Medicaid is that Medicaid for adults, that is that it is a little bit more robust. Children receive a lot more early detection and care. And the idea is that they want to prevent health problems, and diagnose them as early as possible so that they could treat them as early as possible. So the goal of EPSDT is to assure that individual children get the health care they need when they need it.
And those children, though, have to first be on Medicaid. So yes. The first step of eligibility is eligible for Medicaid, and then health check comes along as a benefit of Medicaid. Is that one way to think about it?
It's absolutely right. So just to go over very briefly, to be eligible for Medicaid in Wisconsin, you have to be a resident of the state, a U.S. national citizen, permanent resident or legal alien, and and in need of healthcare insurance and assistance. Your financial situation must be characterized as low income or very low income, or you can be pregnant, responsible for a child under the age of 18, blind, disabled, or 65 and over. But for children here, the important part is the income requirements. The federal government puts forth the federal poverty line level each year, which determines the way that Medicaid eligibility works. So depending on how many people are in your household will depend on your eligibility and the eligibility of your children to qualify for health check Medicaid in Wisconsin. So just moving through EPSDT a little bit, like I mentioned, it's for early periodic screening, diagnostic, and treatment. So the idea is that we're trying to assess and identify problems quickly. Supposed to check children's health at age-appropriate intervals, provide screening tests to detect problems, diagnostic tests to follow up with health risks that are identified, and generally treat, correct, reduce, or control problems that are found. I promise I know how to use a computer.
That's okay. I mean, you've probably only been using Zoom for about 12 months, so there's a learning curve involved.
Certainly. So the services that are kind of covered under check EPSDT are relatively comprehensive for children. So health check involves a screening component. That means that per the American Association of Pediatrics, a child is or should receive 30 periodically spaced screenings throughout the 0 to 21 age range. And this means, and these are called well child visits. Sometimes you'll hear them referred to that way. In addition to those health screens, however, there's a few things that federal law prescribes that must be covered under federal Medicaid or under state Medicaid services, and specifically through EPSDT. So these things include comprehensive health and development history, the periodic physical exams, and like I mentioned, these include a comprehensive unclothed physical exam from head to toe, vision screenings, including diagnosis and treatment for defects in vision, including eyeglasses, hearing screenings, which include diagnosis and treatment for defects in hearing, including things like hearing aids. And very important, and something we're not seeing a lot of in Wisconsin, is oral assessments and referral to a primary care dentist. This is a really big piece of overall health for children, and it's one piece that Wisconsin is trying to work on. But to remember to keep in mind as you send your children to get these age-appropriate exams is that they also need to be referred to a dentist. In addition to that, we've got immunizations. Immunizations, so the age-appropriate immunizations we all got when we were kids, booster shots, whatnot, as well as lab tests. A very big reason that the EPSDT service, one of the big things it covered early on in its existence back in the 50s was lead screening. So that is a part of the testing. A lot of people have lead paint or live in areas of previous lead smelting. I'm from Omaha. We had a lot of lead smelting plants. So that was a big deal from where I'm from. But all other lab tests to screen blood for any other issues or toxicities. And then they're also, they being providers, are supposed to provide medical advice and counseling, which is another crucial piece. And finally, unlike federal Medicaid, or unlike Medicaid at the state level, that is usually prescribed by states as to what they're actually going to provide, any medically necessary health service that is covered under federal Medicaid has to be covered under health check. So if it is not, say the state of Wisconsin does not normally cover a Medicaid service, that if it is medically necessary for a child, it does not matter. They have to provide it regardless.
That's a pretty robust coverage.
Yes, it's like I mentioned, it's a lot more robust than the way that that federal Medicaid normally works. And again, the idea is just that children need a little bit higher level of care. And if you can catch these problems early and you can treat them early, they don't turn into big problems as adults.
And so this is the level of care, if I'm understanding you right, Nick, this is the level of care that all children who are enrolled in Medicaid should be receiving from a primary care doctor.
That's correct. All children who are receiving Medicaid care are entitled to all of these services. Now, the providers we have found tend to be a little bit more in the dark. So that's why it's important for you parents at home to gently remind your provider, if you have a child who's on Medicaid receiving services, that if you believe that you're not receiving some of these services, or if you need referrals or whatnot, just keep it in mind to maybe gently remind your provider that these are necessary, and your child is entitled to all of them.
And I think that's also important as children get to be of school age and we start to talk about those immunizations, is that if you have Medicaid, you have access to those immunizations through Medicaid. Is that you don't have to deal with it yourself. You go to your provider and say, the school says that I need this and I don't have a record of this. And it's an immunization. And so that should be covered.
That's a great point, Tim. Yes, absolutely. So as we all know, in order for most public education, you have to have proof of immunizations. And that's not something that if your child qualifies for Medicaid, that's not something you should have to pay for. All of those immunizations are all covered and free through Wisconsin's health check program.
And I also love the fact that you brought up about especially the vision and dental and hearing services, because a lot of times our kids, we're not made aware of that, or we don't think about it until the school starts to do some just initial screenings. But the fact that through Medicaid, through Health Check, you have access to vision and dental services so that you can catch those problems earlier on and help the kid be ready for learning earlier.
Absolutely. It shouldn't have to wait until your child goes to school in order to get a lot of these services. I know that public schools perform some of these screenings as well. However, children who say have vision issues a lot earlier are going to have problems reading, or maybe aren't taking to learning through their kindergarten or preschool programs because they can't hear properly. And all of those services are also covered. And I'm glad you brought some attention to it, Tim, because like I mentioned with dental, vision and hearing services and screenings aren't always, the providers don't always remember that those are also covered under Health Check. And so again, as advocates, as an advocate, I try really hard to remind parents, that their children are entitled to all of these things. And so if you notice an issue, or even if you don't, and you want to make sure that your child is screened, I mean, as part of their well child visit, they should be screened for all of these things.
So knowing you're a legal advocate and you talk to parents about this, how would you recommend if a parent's listening to this and they know they have Medicaid and their doctor's not giving periodic physical exams, or they're not, setting up, and they'd love to have their kids' vision checked, but their doctor's never mentioned it, or their provider has never mentioned it. How can families help nudge? They shouldn't have to, but how can families help nudge the medical community to provide the services that they're entitled to?
That's a great question. So I will, at the very end of this, I'll provide some resources that you can send to your provider, including Forward Health, which is Wisconsin Medicaid's website, on what providers are supposed to be providing. I will note here that if they are a Medicaid provider, so if you're taking your child to a Medicaid provider, they are required to provide some of these services. And as such, they should be aware of them. As you point out, they're not always. But we have resources that I can give you to kind of nudge them in that direction. But also, that's why I'm here today, is to promote to the parents to know what their children are entitled for, so they can kind of make that known to providers. Now, the providers should be aware of it, and part of federal law is that part of federal law for what Medicaid programs, including here in Wisconsin, is that they should be reaching out to educate these providers. I will note that Wisconsin Medicaid does have some programs to try to provide more of this information, outreach, education to providers, but recognize also that, as I see, as I'm sure many of you have also experienced out there, this is not always the practice of the boots on the ground. We've noticed a lot of providers are not aware of the service, or at least that they don't know that it's called Health Check and that there are other services that are provided under it. So it's important to remind them and to provide them with, sometimes you have to do a little bit of the educating, which is why I'm here to educate as well.
Absolutely, because there's a lot that providers have on their plate, and trying to keep all that in line. And sometimes they just need to be reminded that this coverage comes with these services. And that's really helpful, which is why we're glad that you're here today. Another quick question. I know you got some more slides, but so right now, living in the days of COVID, are these still available through telehealth?
Absolutely. So telehealth, at the beginning of the pandemic, we saw a big move towards telehealth. And while Medicaid was a little slower to catch up, telehealth has become an extremely important piece of providing services to families. Obviously, a lot of folks have elderly parents that they might be caring for at home, might have pre-existing medical conditions, or their children might, and they don't want to expose their children to potentially dangerous doctors' offices. They might have sick folks. So telehealth is absolutely a part of this currently, in terms of you can still get exams. Obviously, you can't get things like immunizations and lab tests via telehealth, but many of the screening services and the sort of development history and health questions and stuff can be done via telehealth, and that is covered under Medicaid.
I'm busy answering the question in the chat box, so please feel free to go on.
Sorry, I did not see anything in the chat box.
It's the asking if the PowerPoint will be available, and yes.
Yes.
I believe we'll be able to make that available, and I'm just putting in the website that it will
Absolutely.
be available at. Because we want to
Absolutely.
get this information out and we want this information shared.
I'll absolutely make this available. And then I, like I mentioned, I have some resources for everybody to reference at the end as well. After Health Check was created, they were finding medical issues, which were identified with a lot of these screens, but people were not able to pay for the treatment. So the thing that came up, that the government came up with, was what's called Health Check Other Services, also known as EPSDT Other Services, which means, kind of like I mentioned, the states are required to provide any additional healthcare services that are coverable under federal Medicaid. The sort of caveat is that they have to be medically necessary, and they have to treat, correct, or reduce illnesses and conditions discovered, regardless of whether the service is covered. So if a medical problem is identified during a screening, for example, the child needs treatment and follow-up, then a provider can write an order or prescription, like they would for a medication, for that service.
So then that parent or whatever can take that prescription and go to that specialist or receive that service or that therapy. It sounds too simple.
It is relatively simple, but it includes a lot of language that might seem a little bit convoluted. So, like I mentioned, when a screening indicates that there's need for further evaluation and that more diagnostic services are provided, necessary referrals are supposed to be made without delay. And those services are probably going to need what's called a prior authorization, or a PA. Yes. And the PA is, don't be too scared of the term. A PA, all it means is that a provider has to, before a service can be covered, they have to show that it is medically necessary for the child, and they kind of make the case why it is so. So as an advocate, I've had to kind of nudge doctors in that direction a few times. And as a parent, we have to act as advocates for our kids. And so just remember to talk to the provider and ensure that they're talking about why the services are medically necessary. And they should understand what that means. But just to give you an idea of the sorts of things that other services covers. So I've got on here just some examples that I've found and that we see pretty often. So things like durable medical equipment. So say you have a child with spina bifida who has problems walking, and you need certain devices in order to help them stand, help them learn to walk, things like that. Wheelchairs, obviously. Those things are normally covered under other services, but may not necessarily always be covered under federal Medicaid. Speech therapy, hearing therapy, occupational therapy, physical therapy, all of those, if again, they're medically necessary, are covered under Health Check.
Can I ask a quick question, which is horrible of me because it's a question I don't know the answer to, and you're never supposed to ask questions that you never know the answer to?
I might ramble for a while, but sure.
That's right. You might have caveats to throw in there, which is a fun word, by the way. With the speech and hearing occupational physical therapy, I know that sometimes I'm more familiar with private insurance than the Medicaid insurance, but I know sometimes there's a certain level, a certain number of visits or therapy sessions that are covered. Using Health Check Other Services, EPSDT, can that help get more therapy covered if the doctor determines that it is medically necessary for more speech therapy?
That's a great question. You're right. For federal Medicaid, or for, I guess, the rest of Wisconsin state Medicaid, there's a certain number of therapy sessions that are typically covered, and that's all outlined on Forward Health. For Health Check Other Services, the case is that it's come back to that medical necessity. So long as the child needs additional physical therapy outside of what is typically covered in Wisconsin, that doesn't matter. That what matters is that it's a medical necessity and that it would typically be covered under federal Medicaid, which I don't believe, maybe you wouldn't quote me on this one, but I don't believe that federal Medicaid outlines or stipulates a maximum number of therapy sessions. So I've seen with my own work through ABC, we've seen children who have to go to therapy far in excess of what you would normally see for things covered under the rest of Medicaid in Wisconsin. So again, things like augmentative communication devices, medical supplies. So say your child has needs insulin or has to have their blood drawn, things like that should be covered. Orthodontia. Now, things I should put a caveat here, back to that word, that you cannot just get orthodontia for aesthetic purposes. And this applies to a lot of procedures, aesthetic procedures that aren't used to treat some sort of medically necessary to treat some sort of illness will not be covered. However, if say the child is having troubles eating, or if their teeth are say pinched or cutting into nerves, pinching nerves, that sort of orthodontia can be covered. But again, medical necessity, that's the bottom line here.
All right. And I'm going to go to the chat box because we're going to get into the weeds, which I love this.
Sure.
Is there special coding or documentation needed when medical providers, and it wouldn't be the vendors, but you have to be the medical provider. So the question, I'm just going to read the question, then you can interpret, okay?
Okay.
Is there special coding or documentation needed when medical providers or vendors for OTCs or DME need to submit when putting in a prior authorization to let Medicaid know this would fall under the program? So and my understanding is the medical providers have to put in for that prior authorization. How can they do that in such a way? How can they word it or code it so that it gets under Medicaid other services and has a better chance of getting accepted and authorized?
Absolutely. That's a great question. And that's something that comes up a lot. So for these prior authorization requests, it used to be that they had to fill out a completely separate, they check the box and fill out a completely separate Medicaid or health check other services form. That is no longer the case, as they've tried to kind of streamline the process. I do believe that all prior authorization requests have to go through the Medicaid or the health check, other services exam. They have to basically look for other services regardless of whether that box is checked. It definitely helps to check the box anyway. But the way that you want your provider to structure the request, the prior authorization request, is just to lay out very clear medical terms, what the illness is or what the issue is that they're trying to ameliorate, that it is medically necessary and why it is medically necessary. And that's obviously going to differ depending on the situation, but that language right there, that your child has this condition, say your child has a psychiatric condition, for example, that's going to require specialized therapy. They might say that, the child has this psychiatric condition, which are causing these problems, and this sort of therapy is medically necessary to ameliorate or help provide assistance for those problems in the following ways, and kind of detail those out. It doesn't have to be super extensive, but it needs to be, in medically recognized terms, because in some cases, actual doctors will be reviewing these. That's normally down the appeals line, but it's helpful to just kind of get it all in the first spot, so that you don't have to go through the process of trying to appeal a decision and such. So just we've noticed that a lot of providers get a little lazy. So just again, as an advocate for your child, just remember to kind of nudge them in the direction and let them know, what is necessary for them to put on the authorization form in order to get what's needed for your child.
And I'll put in here from just a little bit of experience, is that it's always helpful, depending on where your child is receiving medical care, to have some sort of relationship with the nurse, the office manager, a relationship for someone besides the doctor, so that you can have someone else help nudge the doctor, because the physicians can get very busy. And I have found that when I have a relationship with when my children are younger with the nurses, that I could call the nurse and the nurse would follow up and be able to nudge the doctor a lot easier than I would be able to get a hold of the doctor to nudge them. And so think about who else at that clinic that you might be able to have that relationship with that can help you in that nudging.
Absolutely. Providers, the actual physicians and stuff have quite a bit on their plate, as do nurses. But similarly, we've found that some folks at clinics tend to be a little bit more in the know and a little bit more on top of how these prior authorization requests work and what to do for them. So that's excellent advice.
And so with the durable medical equipment, so there's no special documentation. They just have to turn in the prior authorization. and medical. So why it's needed, what's going on, that this is medically necessary, why it's medically necessary, and how they think it's going to help solve the problem or help the patient.
Absolutely. It helps to have some, particularly for things like durable medical equipment, because there are added criteria on durable medical equipment, just in terms of that it has to be kind of the cheapest option available. And there's other things that are going to go on there. So you can't just get anything that's going to help, right? It has to fit these other criteria, and that it's cheap, that it's shown to be effective. It can't be experimental. Those sorts of things are very important. If it is experimental, there are ways to go around that too, but I think that's a little outside the scope here. But for durable medical equipment, just know that there's a little bit of additional, and it might require just a little bit of research. The provider should be the one who's kind of doing that. We, again, boots on the ground, we find that that's not always the case. So just be prepared and be educated on what your child needs and how you can best advocate for it.
We have another question that I think we'll get to a little bit later. If you want to go ahead and talk a little bit about rehabilitation services, because I know those are really important.
Sure. Rehabilitation services. I have a couple of notes I wanted to put on here is that number one, these should be covered to an extent. The rehabilitation services are one that we have struggled, ABC. We see a lot of this in that it's counties are typically in charge of these certain, depending on what the rehabilitation service is, are typically in charge of sort of placement or finding providers, depending on how, again, on what rehabilitation is actually being used. However, I believe I saw very recently that Wisconsin Medicaid is starting to help with more psychiatric rehabilitation services and substance abuse rehabilitation services, and that those are going to be, that coverage is getting more robust as time goes on. Now, they just recently reported that. I don't know what process that is in yet. I don't know if you're aware of any of that stuff, Tim, but
but that's very exciting to me.
It is, and it's something that we see as very necessary.
Yes.
There's a lot of children who have a very big need for these sorts of things. So it's good that Wisconsin's starting to take it more seriously. And then finally, over-the-counter medication. Not all medication is covered under Wisconsin Medicaid, but again, if it's medically necessary, then your child is entitled to it. And so again, I kind of mentioned that to get these medically necessary other services, you need a PA, prior authorization. And one of the big pieces of Medicaid law are that the state of Wisconsin, all states, but in our case, Wisconsin, must make available all medically necessary services. So to give you an example that we've run into quite a bit, that's going to sort of speak counter to what I just said, is that, so for example, we've had a couple of kids that have needed inpatient psychiatric services, so residential treatment. The onus is on the state of Wisconsin to make available that treatment. So there are inpatient psychiatric service treatments throughout the state, but none of them are covered under state Medicaid, except for very specific situations. And so while part of the law says that Wisconsin must make it available, that doesn't mean that it's always the case. I wish that I could tell you that, that these services are always made available, but that's just not always true. So trust me, I've had to talk to a lot of families to let them know that there's nothing that the state of Wisconsin is doing. And that's something that as advocates, we try to push the state a little bit to try to do, but just know, again, boots on the ground, that the letter of the law is different than the reality of the situation. So it's not always going to be there.
And I know when you start to talk dental and you start to talk kids with special healthcare needs and you start to talk mental health, you can offer a service and you can pay for a service and you can make a service available, but if there's no one to provide the service, it's not going to get provided for. If there's no one there to provide it, it doesn't matter how many times it's allowed. The fact is there's nobody to provide it.
Absolutely. It's kind of the state has sort of this affirmative obligation, but part of it is a resource issue. There aren't always providers who want to be enrolled in state Medicaid. And if there aren't any, then there's no one to provide the service. So just a thing to keep in mind. And trust me, it is frustrating, but it's just something to keep in mind. And there are ways around it. And I have our information at the end of the presentation too. If you ever have any questions on these things, or you're hitting a stone wall, feel free to pick up the phone and give us at ABC a call. We deal with these things all the time, and I can't guarantee that we can, find a solution for you, but we work to find a solution for as many families as is humanly possible.
Well, at least having a place to go when you're told no, to make sure that no is real, because we don't know, as just consumers and families out here. Sometimes we get used to accepting that no from the professionals. And then we hear that somebody else received this. And so having somewhere to call, like ABC for Health, and saying, okay, this is the situation. And it just seems like I listened to your presentation, Nick, and I think this should be covered, but they're telling me no. And so they can call ABC for Health, and you guys can talk that over with them.
Absolutely. And we do that often. A lot of parents get told no improperly. Or have services that are improperly denied, or have coverage that is improperly denied. Those are all issues that, despite federal and state law that outline that these things have to be, provided, that these kids should be eligible. It's not always carried out that way. I'm sure everybody who's listening to this has had their own frustrating stories. But to that extent, also, don't forget about your regional centers. The regional centers also are good resources to kind of help direct you and educate and then provide some help.
And I like the fact that, I know Southern and all the other 4 regional centers work closely with ABC for Health. ABC for Health provides some basic training, basic knowledge, provides resources so that we can answer some of the more basic questions, but that we also know they're there when the questions have us head scratching, and we know that ABC for Health probably has the answer because they've dealt with it before. We're going to refer to them. We're going to talk to them. We're going to get back to the family, or we're going to hand off the family to ABC for Health. So it's always a good place to start.
Absolutely. We're all on the same team here. So it's
Absolutely
wonderful to have a good partnership. So I'll just throw on our resources page here to give everybody on the call a little idea. So Health Watch Wisconsin is a kind of an advocates group that's built for promoting kind of the different or educating the different aspects of Wisconsin Medicaid or other health law policy. So we have a health check page that I would encourage you to check out if you have any kind of broad questions. I mentioned earlier as well that there's a resource from Forward Health for providers on what health check is, what's covered, and it really goes into a lot of depth and detail that you probably don't want to know, although feel free absolutely to go and read through it. I wouldn't say it's an exciting read, but it's certainly informative. And then I've got our number and our email address for ABC for Health. I didn't really start with this, but to give a little background on what we are and what we do. ABC for Health we're a nonprofit public interest law firm that we help folks specifically with like coverage issues, healthcare coverage issues, and to a lesser extent with denials of coverage for certain treatments or for a denial of like the treatment or medication or services that to which you are entitled. So if you ever have an issue or something, feel free to give us a call. We try to help everybody that we can. We have the number down there is to our general line. Right now, we're all working remotely. So just leave a detailed message. Tell us when the best time to get back to you is, and we'll get back to you just as soon as we can. If not that day, then probably the next day.
Cool. And so back to this question that was in the chat box. I think now is a good time to get to it. So how does Health Check Other Services, Medicaid in general too, how does Health Check Other Services work with private family insurance coverage a child may have as primary? So we know that you're allowed to have Medicaid and private insurance, and that private insurance, the bill always goes to them first. So where in here does Health Check Other Services fall if the kid has a primary private insurance?
Sure, that's an excellent question. So the answer is a little bit convoluted. So typically when a child has a primary insurance provider, and then they have secondary kind of Medicaid. It will depend on the type of Medicaid that they have. So, for example, Katie Beckett Medicaid, which folks who are above the income level may have, that's kind of their secondary insurance, that kind of has its own different requirements. However, the way that Health Check works and other services works is such that if your primary insurance provider is not covering it and it is on the back end, it's, say they're not covering it, it gets billed then to Medicaid as the insurer of last resort. That then, if it is again medically necessary, then it should be covered. And this is an issue that we have that comes up quite a bit, and it's one where it's any medically necessary treatment to ameliorate a disease or anything should be covered. But again, it always goes to your primary insurance, your private insurance first.
So in that case you just described, where private insurance says, nope, not us. We don't cover this. Check your policy. We're really sure we don't cover this, and they don't. And then it should automatically get billed if you have Medicaid as a secondary insurance and Health Check other service. And if that then gets denied, who appeals that? Who says, we really think this is medically necessary and we think this should be covered?
So the appeals process is such that anybody can appeal any decision from Medicaid for a denial of coverage of any service. So, like I mentioned before, it sometimes helps to have a second set of eyes on it, which is what we at ABC do. We're nonprofits, so we don't have the resources to take everybody on and represent them as clients. But if you ever have any issues that you think something was unfairly denied, we can certainly talk it through with you and see what your options are. But a lot of, if we can't represent you, sometimes we can coach families in how to appeal. But the bottom line is that the responsibility for appealing is on the parent, which is unfortunate. But I know everyone's busy. It's kind of a complicated system, but you should be getting a denial letter from Medicaid, should be mailed to you. And that letter should include the process for appealing, the amount of time you have to appeal. And remember to always keep attention to the deadlines. It's very important. So you appeal, I think it's 60 days for a lot of denials, depending. And then, so you can appeal, they'll check it. And then if the appeal is then denied, that's not the end of the world, because then you can potentially take it to it could be peer reviewed. So the doctor and doctor from state Medicaid can review it together to try to make the case. You could go to a fair hearing, which means it goes before an administrative judge. So there are other options, and all of that gets outlined to you in the appeal letter. But again, if you ever have any questions on that process, feel free to reach out to us. We get a lot of concerned parents that get some questions on what they think that they've been unfairly denied services or coverage, and what the appeal process might look like.
So just to stay on the appeals process for just a little bit longer, I don't want to get too deep into the weeds, but I know appeals can get into the weeds. So you get this denial letter and you look at what you're supposed to do to appeal. Should you bring in, is your doctor receiving a denial letter? Do they know that the service has been denied? Should you reach out to your doctor and say, look, I know we talked about this therapy and we think it's medically necessary, and Medicaid saying no? Who informs the doctor that their medically necessary opinion has been thwarted?
So a lot of times the doctor's office will also receive a notification that the service has been denied. I know that this is not always the case, just because we've had anecdotal folks saying that their doctor was not aware of this or whatnot. So always follow up with your treating provider. But at the very least, you'll receive the notice, and then and you can also kind of talk to your doctor then about how you'd like to approach an appeal. So sometimes it might be denied because your doctor did not write a letter or a prior authorization request that was robust enough. That happens a lot. And so sometimes it's as easy as you appeal, your doctor provides a better letter or provides a more detailed reason why it's medically necessary, and then the appeal could be approved, and you get your coverage. So sometimes it's as easy as that. A lot of times it's not, but it's definitely useful to talk it through with your provider and see if you can't get a little bit of more robust request.
And that goes back to the whole, if we can see this as a partnership in the medical care, that it's the doctor and the nurse and the office manager and all those people and the family working together for that medical care of that child, that whole sense of it's a medical home where they're watching out for you and you're partnering with them in the care for that child.
Absolutely.
Then you have that relationship.
I
You
mean,
feel comfortable saying, hey, they denied it. And hopefully the doctor will be as upset with you as you, not with you, but upset as you are that it got denied.
it takes a village, and absolutely, particularly for our children who have special healthcare needs, who are developmentally disabled, anything. It takes even more effort, from everybody involved. But your doctor, it's a good reason to maintain a good relationship with your provider, and it doesn't have to just be a doctor. I really want to point that out. It can be a nurse practitioner. I mean, there's all kinds of resources and providers that are just fine for providing a lot of these services. So it's just having a good relationship with them, making sure that they're aware of the situation so that they can help you as best, and you can partner with them as best as possible.
Awesome. And we do have some time. Anybody who is on the call, if you have any questions, please feel free to unmute yourself. I will notice that you are unmuted and I will call on you, or you can place it in the chat box. Give it just a couple more minutes. So this is where I should have one question in my back pocket to ask you as people are thinking of their other questions. But Nick, I'm just not that good. Just you get me as I am.
I'm sure it's because I just provided such great explanations. You couldn't possibly think of a question.
There is nothing else to cover. You are the Wizard of Oz of EPSDT. There's just no doubt about it.
Yeah, there's a person behind a curtain behind me.
That's well, yeah, and he's called the Lawyer of the Year.
That's right.
So he's awesome. I'm not seeing any questions coming up any place. Do you have any final words or encouragement or anything else that you can let us know?
Sure. I just really want to kind of hammer home the point that the better educated that you can be and the better advocate you can be for your child and the better educated our providers can be certainly goes a really long way for ensuring that these children get the resources and the services that they are entitled to. I know it seems daunting, and that's why I really stress that if you ever have any questions at all, please feel free to reach out to ABC for Health. We deal with thousands of clients a year, and we really try our hardest to try to make sure people are educated. So you don't have to go it alone, but I'm sure everybody here has had to do their own research for their children and has had to kind of act as an advocate before. And so I just really stress that it's these are really important services, and your children are entitled to them, and you should take advantage of them.
Well, thank you so much. Thanks for being here, Nick. Thanks for what I believe has been you've probably studied a little bit and you've learned a few things along the way to get to the point where you can share that information with us and our families. And we really do appreciate that. And we appreciate what ABC for Health does.
I'm very happy to provide any sort of information that I can. Like I said, it's very important. We're all educated on these services.
Absolutely. And if people have a moment in the chat box, I have posted a link to the feedback. We like to know how these are going. And if you have any ideas for future conversations aren't showing up for kids. And so we're going to stop the recording now, but please do feel free to hang on just for a few minutes. We'll hang on here if there's any sort of off recording questions that people may want to ask. So thanks a lot. Have a great afternoon.
Thank you.